So let's talk about some common phrases that doctors use when presenting a patient's history findings. Okay, so these are phrases that doctors will use to introduce part of the history or to transition from one part of the history to the next. Okay, so let's go through each of them. So we could say his past medical history is significant for coronary artery disease. The surgical history is significant for an appendectomy. His social history is pertinent for a history of smoking for the past 3 years. Pertinent family history includes a father who died at age 62 of a heart attack. She has a family history of diabetes. Regarding his surgical history, he had a cholecystectomy 3 years ago. Concerning his past medical history, he is diabetic. She has no significant past medical history. Okay, so we can say, so for surgical history, we can say she has no surgical history. If she's not had any surgeries, we can say she has no surgical history. Okay, for past medical history, we want to include the word significant because of course, every person has some kind of past medical history. But if it's not significant to the case, we could say she has no significant past medical history, for example. Okay. And then otherwise, his review of systems is negative. Okay, so we're going to talk a little bit more in the next video about specific phrases that we'll use when reporting review of systems finding. We can use some of these to introduce the review of systems. So for example, we could say concerning his review of systems, and then we give the patient denies this, the patient reports this. Okay, so we can use some of these phrases to introduce the review of systems, but then we're going to talk about more specific phrases and things that we can say when we're reporting the review of systems findings. Okay, medications and allergies, we put a little bit separate because it doesn't work for all of these. Okay, so we can say these ones regarding his medications, concerning his allergies. She has no allergies. Those would all work. We can also sometimes will report medication history. Okay, so her medication history is pertinent for, we could say that. But really for medications and allergies, I would say these are the two that fit best when we're introducing medications or wanting to talk about the patient's allergies. So regarding her medications or concerning her allergies, concerning his medications, regarding his allergies. Okay, that would work. The rest of them, for past medical history, surgical, social, and family history, this would work for all of these. And then for review of systems, like I mentioned, this would work to introduce, okay, especially the regarding his review systems or concerning his review systems is pertinent for, and then continue. But we'll talk about more specific and things that we can say with the review systems. We can also say the review systems is negative. We can't say that about any other part of the history. So we can't say his allergies are negative. We can say he has no allergies or he takes no medications. But we can say otherwise, or his review systems, her review systems is negative. So these are just some helpful phrases you can use. We want you to practice using them, okay? So next, what we want you to do is use your workbook. In the workbook, you have a patient case. And that's specifically looking at the patient's past medical history, surgical history, family history, and social history. So read each part. So read, for example, the patient's past medical history, and then using these phrases, think about or jot down some phrases for how you could present the patient's past medical history, okay? So you'll go through each part of past medical, surgical, family history, and social history, and think about how you would present. You do not need to write up the full history, okay? So we're gonna talk about this in our live session. So you can present what you prepared at our live session, but you don't need to write up a full history here. The goal is not for you to write it, it's to have you practice presenting this orally like you will be doing for your final patient presentation. Okay, so you'll read through each part of the history for this patient and then go back to the phrases that we introduced and think about how you can use these phrases to describe the patient's history. Okay, and then there's a space in your notebook to jot down some notes. Again, this does not need to be, you don't need to write the full history here. That's not the goal, but just think about what phrases you would use where, and then how you would describe. The social history in this case is a bit challenging to report. So if you want to challenge, kind of think through this information and try to synthesize how you would present this patient's social history to a colleague. And then we'll go over all this during our live session.